We offer you free digital eye examinations by our highly qualified optometrists at our 14 locations nationwide. A wide range of designer eyewear for the entire family. 25% off when you bring us your prescription. Plus, we have affordable payment options for you with Quartz-ready finance and our Forever 18 plan. We pride ourselves in providing you with the best eye care. Quartz Optical. Value you can see.
Hi, this is JD. I'm inviting you to join me and Dr. Asante LeBlanc right here on I-95.5 FM for our brand new segment, The Live Checkup, every Tuesday from 10:30 to 11 a.m. Together, we will take you on a journey of health and well-being as we explore every level of traditional and alternative medicine. Dr. LeBlanc will be ready to answer all your questions on air. So tune in to the most interactive health talk show, The Live Checkup, Tuesdays from 10:30 to 11 a.m. This feature is sponsored by Unicoma Trinidad Limited. Good morning again, guys. It's just about 10:30, and as you just heard, we are now inside of the live checkup, which is coming to you courtesy our friends at Quartz. You just heard the intro. Thank you so much, as always, to Quartz. In studio with me, I've got Dr. Asante LeBlanc. Good morning to you, Dr. LeBlanc. How are you doing?
Good morning, JD. Good morning to your listeners, our listeners,
yes,
and viewers on Facebook Live. Right?
Yes.
I'm doing well. I'm in studio, cautious but here.
Cautious but here. So true. And it's something we all need to do right now.
Yes.
Be very cautious.
Yes.
You know, one of the things I always want to ask those of you essential, very essential workers is how you doing? And that's why I really wanted to start off with that, because I know you said to me, when we speak, how are you doing? I'm tired. But, are you taking care of you during the process?
Yes. So most of us are trying to practice what we preach in terms of self-care. It is at times difficult, I must admit, because of what we signed up for.
Yeah.
But we are pushing through, and we are trying to take care of ourselves, because without taking care of ourselves, then we don't have much more to give. So we're doing it. It's a very tight line of balance, a very fine line, but we're managing.
And especially when you have information coming in every day pertaining to COVID-19. This morning, you remember I told you what I heard this morning, and I was like, what?
Yes.
There's always new updates on this virus. So, we have so many different things inside of the live checkup in terms of conversation, different health topics that are very pertinent. But every time we try to move into something else,
COVID takes over.
COVID comes back into it.
It's important.
It hasn't left us, but
it never left.
Yeah, but it is very important that we revisit some conversations on
sure.
it. And this is what we're doing today. So some of you may say, we know enough about COVID-19. You know what? I don't think people do, because yesterday, standing in the supermarket, outside the supermarket, I had to give this man a look, Asante, because that was certainly 3 feet, so you have persons still needing to have the information there so we can do better. So I want you to start off, Doc. Of course, you got to say, thank you to Quartz, and I know you are, of course, the owner of Victoria Clinic, so you got to say good morning to your team.
Good morning to my wonderful team at Victoria Clinic. Really and truly, and thank you to Quartz. JD, I think a lot of what we're seeing now is the COVID fatigue that is talked about. But it's so important now for Trinidad and Tobago, for the citizens, the residents, everyone here, to understand that the fight is not over. And only if we cooperate and do what is right will we win this battle. We have to push through.
And we're hearing that plea from those in authority as well, whether it's the Prime Minister, the Minister of Health, consistent. Yeah. You're seeing Dr. Parasom, you're even hearing his annoyance in his voice too, because they've been saying this for so long.
It's frustrating to know that we have explained the mode of transmission. We have explained that with the new variants, we have an increase of transmissibility. We have explained that we're seeing sicker people. We have seen, we don't even have to explain it. We are seeing it. You're seeing younger people die, people without comorbid conditions. And that is what is scary to us as first liners and healthcare professionals. And that's why it's so important, JD, for us to remember the basics. You mentioned it on your ads. Wash your hands. cough and sneeze into the crook of your elbow. Stay home if you're sick. If you have flu-like symptoms, stay home. Reach out to your doctors via telemedicine, which is available at most of the GP practices now and most of the health centers. Call into the hotlines, Don't give up, Use your hand sanitizer if you don't have the water and soap available. Wear your mask, covering your nose and your mouth. It's so important. And now, JD, with the CDC letting us know that, and it's important to understand that it's not news, Let me tell you the difference. We knew that the virus was airborne.
Right.
Why do I say this? Transmission of the virus is from respiratory droplets from my mouth and nose to the person next to me.
Yes.
Because every time you talk and breathe, respiratory droplets come out. What did the CDC change? They found now that we have different size of droplets, right? The bigger ones, the bigger droplets, they will drop due to gravity and not transmit further than 6 feet. But now we have droplets that are less than 5 micrometers in diameter. So that's very microscopic, right? And those they're traveling further than 6 feet. What does this mean for us?
Yes,
it
please.
means that we have to look at our environments, ventilation. You have to have better ventilated areas. If you're indoors, open your windows if you can. We have to look at wearing the mask. Because if somebody who has COVID-19 doesn't know it and they sneeze and cough, let's say in the aisle of the supermarket, their microscopic droplets are traveling. If it's a heavy viral load in those droplets and you walk through without your mask or without wearing your mask, and then you take your hands as well without the mask, but then your hands are all over, and you take those dirty hands and you rub your nose or you rub your eye, you have now encouraged transmission to yourself. So why are we saying this? We're saying this because we need you to be cautious. We're understanding this virus more and more. Remember that this is a novel virus, and what we know today, we didn't know last year. JD, remember, we didn't know so much last year, and now we know too much. And we're going to keep finding out more. So it's so important that we follow these simple practices.
And you say simple practices, and there's so many different things I want to throw at you today. We only have 30 minutes. Oh, let's talk to Courts in the future, no? So we can make this a little bit longer. Courts, good morning. So talk about those symptoms quickly. That person's and you know I'm asking you this.
And JD, we're getting tired because I want you to understand, people. If you have a headache, a cough, a cold symptoms, a sneeze, runny eyes, itchy eyes, a sore throat, a fever, inward fever that you're kind of feeling aguish and you don't know what's going on, back pain, nausea, vomiting, loss of taste, loss of smell, I want you to stop and think. Excessive fatigue, like something taking over your body, stop and think. Do not leave your house. Call your healthcare provider. Watch the symptoms. Stay home. If you have extreme shortness of breath, then you have to go to the nearest public health facility.
Let me pass a situation to you. So I heard about this husband who was tested, was feeling a little ill, He was going to check to make sure, do the test. His wife was fine. So his wife went to work and he went to do the test.
Incorrect.
All right. Talk to me.
Incorrect. Let me tell you something. Now,
oh my
if
goodness.
your spouse has symptoms that are reminiscent or remind you of anything cold and flu-like, and they're going to get tested for COVID-19, be cautious, and it's better to be more cautious, and it's better to stay home until those results are received. Because if that person tests positive, you have been a primary contact and you have been exposed to the virus, and you can be carrying the virus and therefore spreading the virus before the government calls you to say quarantine because you're a primary contact. I'm asking everyone to be accountable and responsible. We have to be our brothers and sisters keepers right now, today, forevermore. We have to walk that walk, JD. And I don't know how else we say it. A vaccine doesn't mean take off your mask and party. Stop trying to be essential even we who are essential don't want to be
outside.
essential.
Oh my
so
goodness.
could you please stop the essentiality?
They don't know.
All we are asking for is 2 weeks to get our numbers under control and to flatten that curve. Stop the curve of misinformation. Listen to our leaders and let us cooperate, JD. We need to stop finding these nooks and crannies and these loopholes. I understand. Trust me, I understand what it is not to make money. We understand that. But is 2 weeks of salary going to save your life if you get COVID? When we can't have a hospital bed for you, we don't have a ventilator for you. We have to look at our resources. We have to take control. We have that power, and as a nation and as a people, we need to take responsibility and control and support our leaders and stop the backbiting, the what ifs, the division and the politicizing of this. This is a public health issue. It's a world health issue. It's a pandemic, and we need to understand that. There are countries who are fully vaccinated, let their guard down, and they now have a third or fourth wave. Let us not be careless. And do not blame. Do not think that COVID doesn't exist. And you know what? Don't be afraid. If somebody is standing less than 6 feet away from you with no mask, say, "Excuse me, I think I need some space." And if not, get away. Move away.
I tell them.
Be responsible.
Space. So, you mentioned some of the symptoms. You mentioned the fact that if, even if someone in your family is just, feeling well, you too should take your personal the core of this is personal responsibility, full stop, doc.
That is the core. And I beseech employers to understand. I understand the dilemma, but we have to, and that's what Dr. Rowley asked as well, that employers understand and do their part as well where they can. And I mean, JD, this is a difficult situation. There's so many arguments from all different walks of life, from different points of views. We have from the economic, we have the employers, the employees, we have everything. But we have to do something. When does it end? I said to somebody, and this won't happen, the world needs to take a break. The world needs to stop migration for a little bit. But it's not going to happen because everybody has a different level at which they're at when it comes to this pandemic. And everybody has a different understanding.
We need to take a quick pause inside of the live checkup to say thanks to our sponsor. And we'll come back. And you know what? I promise you guys, I'm just going to chat with the doc 5 more minutes after that. And then I'm going to let you ask questions.
Feels like she's going to let you at me.
No, because I'm looking. Look at the time already. So I need to give them that opportunity.
Definitely.
Let's take a quick pause, all right?
See clearly and choose Quartz Optical. We offer you free digital eye examinations by our highly qualified optometrists at our 14 locations nationwide. A wide range of designer eyewear for the entire family. 25% off when you bring us your prescription. Plus, we have affordable payment options for you with Quartz Ready Finance and our Forever 18 plan. We pride ourselves in providing you with the best eye care. Quartz Optical. Value you can see.
All right, so we're back. We're not wasting any seconds. So I've got Annette. Let me just quickly give you this question on the Facebook page. Good morning, Annette. She says, Doc, what can be done at home if someone has short breath, I should say, due to COVID-19, and the person is waiting on the test results, and you have all the COVID-19 symptoms? There you go.
Great. Annette, that's a great question. So we do have the hotline numbers. So you can call in Trinidad, 877-WELL. And we have 811. Now, I know what you're going to say. Nobody's answering, right? But don't give up, because I've called and they've answered. So you explain to them that you have these symptoms and you are having difficulty breathing. But what is important, and if you can acquire one, it's amazing. It's called a pulse oximeter, which is the little thing Dr. Parsuram showed us on television. And that is so important to get because if you then have a private doctor, you can call them, let them know what's happening, and give them those stats. And based on that, they can advise you what to do. I say this because COVID-19 can give you shortness of breath. It can give you a difficulty breathing, but also the anxiety of what you may have. And if you are waiting, that adds to it. And so you may be having a normal oxygen concentration, but you're panicking. So it's so important. But I definitely recommend, do not pass go. Do not collect 200. If you are short of breath, you are having symptoms of COVID, you have not received your test results, and you cannot get through to the hotline, do not pass go. Do not collect 200. Go to the nearest healthcare facility, and they will give you they will assess you, give you oxygen, and get you stabilized and let you know if you go home or stay.
And so many people are doing that, Dr. LeBlanc, because I think I mentioned to you that my cousin in Florida is literally trying to survive right now. And I keep asking her, why aren't you going to the hospital? And the same thing she's saying. She says her fear is going in and she won't have, not coming out, but she won't be able to see her family because she has to go through this alone. And I think she's in the medical field in terms of a nurse or assistant nurse, something like that. And this morning she says she has pneumonia.
Right. So then she should. Right. But JD, I think what's important is if you're feeling sick, the usual things we do for any cold and respiratory illness. So you remember what your grandmother used to say. So that's warm teas.
Yes.
Nourish the body.
Yes.
Don't deprive the body because COVID can give you loss of appetite. Have a soup. Have dal. Have warm teas, ginger, Spanish thyme, cinnamon. I'm giving you these options. Fever grass. Use those warm teas. Cover your neck. Wear warm clothing. Come out of the AC environment. Be in a ventilated space. Do not lie down all the time. Sit up. Take the sun. Breathe in the fresh air, but don't leave your house. Very important to understand. But if you do have difficulty breathing, do not pass go. Do not collect 200. Find a healthcare professional. And it's best to do the public healthcare institution because of the risk of COVID now.
So here's another question quickly. My questions are coming fast and furious. Okay. So when do we test? Because again, there are some persons that have done tests and in some cases come back negative, and this time
but they're really positive. Yes. So that's a brilliant question. Annette, the word is pulse oximeter. So JD will put that up on Facebook later.
Pulse. Say it. Pulse
oximeter.
Right.
Oximeter.
Yeah.
Right. So you should ideally test from 5 to 7 days of the onset of symptoms. So I like to advise people best to test between 5 to 7 days. I like to wait for the 7th day, depending on the symptoms. If there are very severe symptoms like extreme tiredness, extreme headache, really, really bad loss of taste, loss of smell, then I test earlier, but generally 5 to 7 days of start of symptoms. And if you're in contact with a COVID-19 patient, you're a primary contact, then we like to recommend testing between 7 to 10 days of last day of contact.
And there are many places right now we know that are offering the testing, whether it's the ministry.
Please look at the ministry approved laboratories. Please know that the PCR test is the gold standard test for COVID-19 at this time. Do not be fooled by the rapid antigen testing or the antibody testing.
So what's the difference?
Antibody test is a blood test, and it will tell us if you've come into contact with COVID before, like if you've been a past COVID-19 patient or if you've been vaccinated with a COVID-19 vaccine.
Right.
Your body will have started to produce antibodies against the spike protein. Antigen testing, we're looking for the antigen of the coronavirus family. It's not specific to the COVID-19 SARS-CoV-2 virus. So it's not specific and not very sensitive. So it's very important that if you have signs and symptoms to go to the public healthcare system, a local health center will test you there for free, or the private labs that are approved by the Ministry of Health. And you can find the list of those labs on the website for the Ministry of Health of Trinidad and Tobago.
And the one that you are really pushing to get is the PCR.
Which is the COVID-19 PCR test, and it's with a nasal swab. Yeah. So yes, you're going to have that tickle and burn. It's not going to kill you.
Yeah, it's annoying, isn't it? Yeah. So 12 minutes before the top of the hour, this is the live checkup on I-95.5. Dr. LeBlanc is in studio with me. I'm so loving the fact that you guys are really taking your notes like I am from the doc and really paying attention, because we have to do what we can to stay alive, all right? And one of the things I want to do right now is just say thanks to our sponsor. When we come back, 622 Eyes. You guys got to call quick and to the point, because I want all your questions in before we get news at the top of the hour. So let's say thanks to Quartz.
See clearly and choose Quartz Optical. We offer you free digital eye examinations by our highly qualified optometrists at our 14 locations nationwide. A wide range of designer eyewear for the entire family. 25% off when you bring us your prescription. Plus, we have affordable payment options for you with Quartz Ready Finance and our Forever 18 plan. We pride ourselves in providing you with the best eye care. Quartz Optical. Value you can see.
So we are back in studio. This is the live checkup. The number is 622-EYES. If you've got questions, please don't hesitate to call in. I'm going to try and look at the WhatsApp and also the Facebook, but please make your questions as quickly as possible. We literally have 10 minutes, guys. All right? Good morning. What's your question to the doctor?
Yes, good morning to you. One quick question. Why it is that the authority is not telling people about driving public service vehicles with the air condition up? They're supposed to be open.
Okay.
Somebody needs to be addressing that. Okay, bye-bye and thank you.
Thank you.
I love that. It's so nice to hear that. And so they have said it, but we can reiterate it. When you are in a vehicle that is not your vehicle and you're not alone, it is recommended that you have your windows down and take in and have proper ventilation versus the air conditioning with recirculation of the air. So that also will then, so what that will do is with increased airflow with your windows down, you will decrease the viral concentration if it is present in the droplets. But also wear your masks, cover your nose and mouth. Don't think you have to pull it down to talk on the cell phone. Just wear your mask, right? But definitely open the windows. Some drivers might not like to have their AC on with the windows open, but it is recommended, and it's definitely one of the extra measures that we can take in public transport.
All right. Thank you very much. Good morning. What's your question?
And the doctor.
Good morning. Good morning.
JD, before you go, could you give us a map and give what's going on? Thank you. Listen, Doc, tell us about the reasoning behind the long nasal swab that I see the medical fraternity is using to push through your nasal. It's long enough to go all the way back to touch the back of your skull. Could you give us your reasoning why?
Thank you for your question.
Well, because we have to go to the nasopharynx and we have to go to the posterior wall of the nasopharynx. So it's actually not an extra long swab. And there's actually a mark for us to know how deep to go. So having done swabs myself, I could tell you there are different sizes of nasal passages. So we do not go further than we need to. And we have a certain direction that we need to go in as well to swab. So it's not an extra long swab. It's all a standard size swab. Yeah.
Thank you. Hello. Good morning. What's your question?
Hello. People are asking this question. How is it they are making the exception with air-conditioned offices, who people stay in the offices all day, and put with a vehicle, it's different. Could you explain to me, please?
Staying in offices versus a vehicle?
Like how we're here inside of an air conditioner.
Right, but remember we have gone down to essential services. So for example, even in my medical practice, that's an essential service. My windows are now open versus my air conditioning being on. But there's some service, like JD doesn't have a window for me to open. So, I mean, you have to take extra care. But most...
I-95?
I-95. So most essential offices, if they don't have that ability, they do have to space out their workers, stagger their workers, and have different things in place, different measures in place, I should say.
All right, thank you for that. Hello, good morning. What's your question? Good morning.
Morning.
What's your question to the doctor inside the live checkup?
If somebody goes to work and they found somebody with the virus and they send the people home, while at home, one of the persons in a family, the male, comes home with the virus and is found to have the virus. What precautions have the wife and children to take?
All right.
Great.
Thank you for that question.
So if if you go home and you were in contact with a coworker and you were a primary contact and you went home and then you became positive, your family now they change from secondary contacts to primary contacts. So the best thing to do is to isolate. The minute they sent you home from work, if it was possible, it was to self-isolate in a bedroom and to not be in contact with your family members. Use your mask around them. Sanitize and disinfect every time you use the washroom if you don't have a separate washroom. Sanitize from your kitchen if you don't have a separate kitchen, or let them put food outside your door and literally not have contact. If you test positive and you were not self-isolating, then they become primary contacts, but you already were not self-isolating. So it's just recommended that you all are in quarantine, and I would still recommend that you wear your masks to decrease transmission, but you're all at risk for acquiring the disease.
All right, so as we wait for a few more questions inside of the live checkup, we're just coming to you courtesy our friends at Courts. We've got Dr. Santana
Thank you,
Blah
Courts.
asking, thank you, Courts, answering the questions that you've got. You know, I want to talk about the mask that you're wearing. Now,
Yeah.
now I know you came in with doubled up,
Yes.
right? But persons are walking around with just that. What do you call that mask again?
This is a shield.
The
This is
shield.
a face shield.
Just with a face shield.
Right.
Is that effective on its own?
So what happens is that it's not as effective as if I use a mask. So I had on my KN95 mask, but then you won't hear me through the microphone.
Yes, of course,
right?
which makes
So
sense.
that's why I have on the face shield, even though you have a shield here. But it will stop droplets, my droplets, maybe from coming directly, like decrease the concentration, but it's not as effective. So if you can wear a mask, then do both, because it's also protecting my eyes, as you can see.
Right. Yeah. Hello, good morning. What's your question? Good morning. You're live. You've got a question?
Yes, good morning. Could you give us an idea of whether steaming is effective in treating COVID at home?
What?
Steaming, you said?
Oh, right. So
Okay.
steaming. So that might be considered inhalations. So, I mean, if you go back to when we were sick and we had, chest congestion and everything, we recommend inhalations for that. However, it's not about curing. It won't cure COVID. It won't kill COVID because of the heat, because you can't have that amount of heat going up your nose that will kill COVID. You understand? But I definitely recommend inhalations if you have a lot of chest congestion. But it will not cure COVID, but it will help to alleviate the symptoms of chest congestion. However, please note that they are noting that it may cause aerolization or spread of more COVID particles, because as you breathe out, with the steam. So you want to do that alone, in a room with
alone.
windows that you let that out.
Right. And I keep hearing you saying the importance of ventilation, even at home.
I must say
we have to
that.
do like long time. Long time you open up all the windows in the house. This is what we need to go back to.
Not long time, not this time, because we have crime. But JD, I don't really look at Facebook questions, but this person, the gauntlet, is talking about ivermectin. I think what we need to understand is that there are a lot of therapies that are being tried worldwide, but none have been proven clinically as yet to cure or to alleviate everything with COVID. And ivermectin is a big debate right now. It's an antiparasitic drug, and we have not had enough clinical evidence to utilize it as yet.
All right, we've got a few more questions, 3 more minutes. Wow. Good morning. You're live. What's your question?
My question is, if you are a person over the age of 60, but you have been wearing a mask, but your droplets are a little heavier in speaking, how long should you wear a mask?
All right, thanks for the question.
How long you should wear a mask?
A mask, he's saying.
You need to wear a mask all the time. The only time you don't wear a mask if you're outside your house is if you're eating or drinking. And you shouldn't even eat or drink outside your house because there's no restaurant outside unless you're in office. And then do that outdoors as well. Or not even going to the bathroom. You need to have your mask on going to the bathroom. Nothing to do with your face going to the bathroom. So you need to wear your mask all the time unless you're home. Please wear your mask. Cover your nose and mouth at all times.
Thank you very much. I'm hearing it in your voice. I'm hearing it. Good morning.
Sorry.
What's your question? No problem. No.
Hello.
Appreciate
Hi, good morning.
Good morning.
Let me step away a little bit. Yes, doctor. What topic did you do this morning? Hypertension?
No, we're
Because
speaking about
I
COVID-19. If you have any
understood
questions pertaining to COVID-19 in terms of symptoms or anything like that, do you have a question pertaining to that? Because we're really tight.
You did the hypertension topic anytime soon?
We're doing it pretty soon. Promise you that. We're doing that pretty soon. All right.
Thank you very much.
You're welcome. Thank you, though. Hello, good morning. What's your question?
Hi, good morning.
Good morning.
I'm calling to find out, can I take the second dose in the Sinopharm vaccine if I take the AstraZeneca, the first one?
All right. Thanks for your
Right.
question.
That's a good question. So we're still waiting for approval from the CMO on that. As far as I knew, we had to we have to take the same brand, right? But I do think that we know that if you do one AstraZeneca or similar, then you're allowed to take the same AstraZeneca or similar. So we're waiting for approval from the CMO on that.
And you are my final caller. Good morning.
Yeah, good morning. Hello, don't quick. Yeah, Doctor, morning. I need to put you on the spot like this, but I get any recent information that is valid as actually witnessed it or for the television set that the European Union is no longer using AstraZeneca because they are saying and they canceled their orders, as a matter of fact, the future orders, and donated it donated those what they had remaining to the UN body. What they're saying is that the variant is not effective on the variant, and they more or less go in with the Pfizer and the Moderna.
All right.
Yeah.
Thank you for your
so
question.
that is a long debate, and we discussed this last week. So right now, right now, what we're saying worldwide, whatever vaccine you have available that is WHO approved, that is the best vaccine to take right now. The European Union has canceled their order for AstraZeneca, but the European Union has access to Moderna and Pfizer. So it's not about the effectivity. We do note that it may not be fully effective against certain variants, but it is effective against most of the variants right now. And it's important to understand that the vaccine is not the only thing that's against the virus. It's with other protocols. So it's the vaccine plus everything we've discussed so far. And therefore, remember that having the vaccine and being fully vaccinated allows you to have less symptoms if indeed you acquire the infection.
Right. So, Doc, as always, it's good to have you inside of this. This is the live checkup. Dr. Asante LeBlanc.
Thank you very
much. 10:30 to 11, and we must say thank you very much to Courts. All right, and thank you to our listeners for the questions. Quickly, your contact numbers, because I keep getting both every time, not asking you.
Oh my gosh, Victoria Clinic, 622-2221. 622-0683.
Sorry, say that over slow. Someone said last week. Could you say that slower?
622-2221, 622-0683. And JD, right now, for the established patients, our known patients, please note that we're doing telephone consultations if you have an issue, because we care about you and prefer that you consult with us before you come in due to COVID-19.
All right. Thank you very much, Dr. LeBlanc. Be safe, and again, thank you for doing what you do to save us.
It's a pleasure on behalf of everyone. That's what we're here for.
Thank you. Take care. It is 11 o'clock. Time for the news update. Unika's in studio. We've got to say thanks to these folks first off.
See clearly and choose Quartz Optical. We offer you free digital eye examinations by our highly qualified optometrists at our 14 locations nationwide. A wide range of designer eyewear for the entire family. 25% off when you bring us your prescription. Plus, we have affordable payment options for you with Quartz Ready Finance and our Forever 18 plan. We pride ourselves in providing you with the best eye care. Quartz Optical. Value you can see.